podcasters. Welcome back to Skin the Surface. On today's episode, we will discuss a topic that I think many of us can relate to, and that is excess sweating, also known as hyperhidrosis. But how do you know if your sweating is just normal sweating or excessive? Well, don't sweat it. We're going to get right into it.
Hyperhidrosis is a medical condition that causes excessive sweating. As we know, it is necessary to sweat. Sweating actually helps cool the body and prevents us from overheating. People who do have excessive sweating, on the other hand, sweat when the body does not necessarily need cooling. So where does this excessive sweating usually occur? Well, it typically occurs on the palms, feet, underarms, and head. And as you can imagine, having excessive sweating in these areas can really interfere with one's everyday activities. I have patients who express embarrassment when presenting at work, shaking hands, and even taking pictures because the sweat marks can be sometimes so prominent.
Yeah, that's so true. For many of my patients, this excessive sweating can actually cause significant distress in their personal and professional lives, and that causes a lot of social anxiety. It's embarrassing not only because of the appearance of sweat marks or the feel of clammy hands, but also because anxious sweat can have a bad odor, and that can significantly impact someone's quality of life.
Yeah, this can really pose a problem and often a driving factor for why patients come in to see us. So speaking of that, Mary, who gets hyperhidrosis?
Well, in order to answer that, it's important to distinguish that there are two different types of hyperhidrosis, primary and secondary hyperhidrosis. Primary hyperhidrosis is the most common form of hyperhidrosis, and it's excessive sweating that's not associated with any underlying medical condition. Typically, this excessive sweating occurs in local areas, like you mentioned, Rina, like the palms and soles, and that's particularly in young patients, and as well as the armpit area once you reach puberty. This sweating occurs year-round, and it's seen in warm and cold environments. And people of all ages and races are equally affected. And the majority of patients will actually have a family member with a similar history of hyperhidrosis. This is different from secondary hyperhidrosis, and that's excessive sweating that's due to an underlying medical condition, and that could include thyroid disease, obesity, menopause, or many others, or even a medication that you're taking. And that's why it's so important to consult with your dermatologist for a full evaluation as to the cause of your excessive sweating. So let's get into how we treat excessive sweating. Treatment varies based on where the excessive sweating occurs on the body. Usually by the time we've seen patients, they've already tried an over-the-counter clinical strength deodorant, and these usually have high concentrations of aluminum chloride or aluminum zirconium salts. And these substances temporarily plug up the sweat ducts to minimize sweating. We also have a prescription antiperspirant option for patients who don't get adequate control with the over-the-counter treatment options.
And to add to that, the most important thing is to really look at the label. Many purchase deodorants hoping that it may control their sweating, but in reality, there is a big difference between deodorants and antiperspirants. Deodorants protect against odor, while antiperspirants protect against sweat and odor. And as Mary mentioned, aluminum is the active ingredient in antiperspirants and is typically absent in deodorants. Speaking of aluminum, some have suggested a possible connection between using topicals containing aluminum and breast cancer or Alzheimer's disease. But in fact, to date, there is no evidence that using an antiperspirant can cause breast cancer or Alzheimer's disease. A few over-the-counter antiperspirants that I personally like are Dove Clinical Strength Protection, Certain Dry Prescription Strength, and Secret Clinical Strength.
Beyond antiperspirants and deodorants that block up the sweat glands, some patients actually require a more targeted treatment that prevents them from sweating altogether. And these can be given in the form of wipes, oral medications, or even Botox injections for those who aren't afraid of a needle. Because these treatment options prevent you from sweating altogether, there definitely are greater risks associated with them, such as overheating. And it's so important to discuss with your dermatologist whether these options will be right for you.
That's great, Mary. And just to add, there are some surgical and laser options available to treat excessive sweating. These tend to be more invasive and at times costly and time-consuming, so it's very important to discuss with your dermatologist these alternative treatments. If any of what we discussed today resonates with you or a close family member or friend, don't sweat it. Feel free to check out our website at skinthesurfacepod.com for additional information, links, and resources, including from the International Hyperhidrosis Society. Well, that's all we have for today. Several weeks back, we did talk about a commonly used anti-aging treatment for fine lines and wrinkles called Botox. So get excited, podcasters, because next week we will discuss another treatment that can be used simultaneously to help add back that volume and fullness to the skin.